Good day again and very welcome at the assessment of the fetal status using the cardiotachograph slides. I'm still Anna Nolte, and in this lesson now we're going to do some more physiological aspects of the control of the fetal heart. Now we're going to discuss baroreceptors, chemoreceptors and fetal adrenal glands and some other factors that might also play a role in the control of the fetal heart. Now, if we look at baroreceptors, they are located in the big walls of the arteries here at the top of the fetal heart, and they respond to pressure changes. Baro means pressure, so they respond to blood pressure changes. And then they send a signal to the brain system, and this brain system activates the parasympathetic nervous system. And remember, I've told you will hear many more times about parasympathetic and sympathetic. And parasympathetic, I've told you, decreases the fetal heart rate. So when there are pressure changes, we get this baroreceptors being stimulated. They send a message to the nervous system, the parasympathetic nervous system, which decreases the fetal heart. Now, this usually happens when there are the fetal arterial pressure changes because there's compression of the umbilical cord. Now, I usually explain it the same as when you have a tap with a hose pipe that has a kink in it, and the moment you open the tap, and if there's no kink in, if you open the tap, there's a certain pressure in the hose pipe, and the moment that you kink the pipe, obviously the pressure in the pipe will become higher. And this is the same here. We get some or other compression of the umbilical cord because the umbilical cord is tightly around the neck, or there's a cord prolapse, or it's just been kinked at some other place around the baby's arm or whatever. And that makes that when there comes a contraction, for example, we get that there's more pressure on this compression of the umbilical cord. We get this increase in arterial pressure, and that causes a stimulation of the baroreceptors because we've said a change in the blood pressure stimulates these baroreceptors, and they activate the parasympathetic nervous system, as we've said, and that reduces the fetal heart rate. And then when the compression is over, like for example when the contraction is over, or the fetus moves, or something makes that there's a little bit less of a compression, we get then that the message goes back to the baroreceptors. It tells the baroreceptors that the arterial pressure is not so high anymore, and then we get that the baseline recovers and it goes back to normal. And this is usually a fast recovery of the baseline. Now, what is very important here is that this deceleration of the fetal heart is not being caused by hypoxia. It's only been caused by a change in pressure on the umbilical cord. Now, if we look at the chemoreceptors, they also sit here in the big arteries at the top of the fetal heart, and their name says that they are chemoreceptors. They receiving chemical messages. So what happens here is if the oxygen becomes low or the CO2 becomes high, there goes messages to the chemoreceptors. They also respond by reacting to the nervous system. They also stimulate parasympathetic nervous system, which decreases the fetal heart. So, in other words, we get the low PaO2, a low pressure in oxygen because of some or other reason, and increased CO2, and also more hydrogen ions are forming, and that stimulates the chemoreceptors, and this is usually a pattern of hypoxia. That activates the parasympathetic nervous system. The parasympathetic nervous system, we've said, lower the fetal heart rate. And this takes quite a longer time to recover because first of all, now usually when in the previous where we had done the baroreceptors, when the pressure has been lifted, there's an immediate reaction, but it usually takes a longer time for the PO2 to recover in the blood. So these decelerations are usually much longer decelerations. And this is usually, as we've said there, due to a lack of oxygen. It's usually hypoxia. So it might also reduce the baseline variability. Remember, we've said in part 1 of lesson 4 that the variability that depends to a very large extent on oxygen provision to the parasympathetic nervous system. So if there's not enough oxygen, it might also decrease the baseline. Now, if we look at the fetal adrenal gland and what role that plays in the control of the fetal heart, we say that in response to persistent hypoxic stress, so there was now hypoxia, the chemoreceptors have been stimulated, the whole reaction happened, etc. But this hypoxia persists now. We eventually get that the fetal adrenal glands are being stimulated, and they release catecholamines. And catecholamines stimulates the sympathetic nervous system, while all the previous two have stimulated the parasympathetic nervous system. This one stimulates the sympathetic nervous system, which we know, you were supposed to remember that, increases the fetal heart rate. Now, so when a fetus is now exposed to continuing hypoxia, as we said, it causes stimulation of the adrenal gland. And what happens now, the reason for this is that the fetal heart rate increases in order to protect the essential organs against hypoxia, against the oxygen deficiency. So the fetal heart beats faster so that more oxygen can go to the essential organs, namely the brain, the heart, and the adrenal gland. And at the same time also causes peripheral vasoconstriction so that less blood goes to all the other non-vital organs. And that's one of the reasons why in the case of persistent hypoxia, babies are being born very pale, is because of this peripheral vasoconstriction, which is almost, I want to say, a late effect of continuing hypoxia. And that eventually together with the adrenal gland stimulation and the catecholamines, increases the fetal heart rate in order for all this to happen. And then if we just look at some other factors which also influence the fetal heart, maternal temperature plays a big role. Maternal temperature is a big reason for fetal tachycardia. So often when we find that the fetus has fetal tachycardia, the maternal temperature is one of the first places where one should go and have a look and see whether she's not having an increased temperature. Some other medications might have an influence on the fetal heart rate in the sense of either increasing it or decreasing it. So we also must always make sure when we look at the fetal heart rate, what medications the mother get. She might get some, as I'm saying, like in tocolysis that we use to take contractions away, have an influence on the fetal heart. When she gets pain medication during labor, has an influence on fetal heart, etc. When the mother gets some other sedatives, it has an influence on the variability, etc. Sorry. Sometimes when we stimulate the fetus mechanically, like for example when we do a vaginal examination and touch the fetal head, we sometimes get a temporary increase in the fetal heart rate and we get a little bit of a tachycardia. It might also cause the fetus to move a little bit more, and because of that we get accelerations and even a little bit of an increase in the variability. Maternal hypovolemia and hypotension in general might cause bradycardia or might cause decelerations. And we might find that, for example, when the mother had an epidural analgesia and we get reactive hypovolemia, we might have an effect. It might have an effect on the fetal heart. Epidural also have a little bit of an effect on the fetal heart because sometimes it causes a little bit of an increase in the maternal temperature. It's just temporary, but that also might cause temporary tachycardia of the fetal heart. Maternal dehydration might have an effect on the fetal heart, and specifically if it goes over to maternal exhaustion and ketoacidosis, etc., it might also have an effect on the fetal heart. And then also fetal cardiac malformations, when there are some genetic cardiac malformations, it will definitely have an influence on the fetal heart. And that brings us to the end of lesson 4, part 2, and the total of lesson 4. So now it's quiz time. Again, you need to determine what knowledge have you gained regarding the physiological control of the fetal heart. And I will see you in lesson 5 if you have passed your quiz. Good luck and enjoy it.